Hello, everyone. Thank you for coming. And I want to thank Stephanie for providing services for us, interpretation services. So it has been a while since we have met. And again, these are pretty interesting times. And it is my great regret that we are not meeting in person. This certainly adds a different complexity to this. So looking back, this has been first a big thank you. Thank you for caring. Thank you for everything that you do for us. Thank you for providing feedback. And thank you for this amazing community. So this has certainly been an interesting 2 years, and it has been a roller coaster ride. It had its own challenges, but it's not only about the challenges, it's the opportunities and what we want to do and how we want to do it and what we have done. And when I came almost 6 years ago, I promised that I will be every year in front of you and be accountable what we did and how we are doing. And this is one of those occasions, and we will continue it regularly. So just to remind you that even in these complex times, we remain true to our mission statements, and we are working hard to be world leaders in transforming the lives. And we do this through 4 different pillars: the community outreach and engagement, the educational programs, research, and patient care. And we are one of the biggest and most comprehensive IDT care institutions in the world. So why do I say that? If you look back, these are the 2020 numbers. We are still working on the 2021 numbers. So we are big, and as you can see, we have the USAID grant, the land grants, the 14 departments, 5 philanthropic boards, 550 employees, and the budget is $42.3 million. It will be pretty similar this year also. And this sort of reinforces that we did well through this pandemic. Actually, we grew services, we managed to have a fiscal stability, and we have more than 19 million in federal, state, and local grants and 3.7 million in philanthropy. We are now closer to 90,000 services yearly, and we provide across the states and across the whole United States services. With a lot of different programs in recreational therapy also. And we serve the community. We provided more than 26,000 hours of service to the families. And we train the community also, and we have almost 5,000 participants who were trained by our providers. So, the education and research portfolio is also impressive, and you can find the newest numbers in our annual report that will be coming out in a couple of months. So, what are the main highlights? Obviously, first is that during the COVID time, we built an amazing facility. And we built it on time and on budget during a pandemic. And again, that's clearly not my achievement, that's the achievement of the community, everyone who participated in it, and I'm eternally grateful for this gift to the community, our new building, and the gift to our patient population and their families. So this is a 91 million unique home with unique features and services. On our website, you can see sort of a video overview that we created for the grand opening. And we really expanded quite a bit from 87,000 to 220,000 square feet. This is the most unique building in the world. Nobody has anything similar to us. We have a full-size gymnasium, 2 pools, an indoor water park, multiple playgrounds, an outpatient center, a new integrated center for autism spectrum disorders, a Caring for Champions program with new vision, dental, and dietary health and wellness services, virtual and augmented reality research laboratory, a new audiology booth, sensory controlled areas with tunable lights for our sensitive patients, escape booths for overwhelmed children. We established a care coordination program. We have a meditation room. We have a 1-bedroom apartment and a teaching kitchen to teach independent living skills. We are working on video access for parents that you can sit in a coffee shop and basically see how the treatment is going on your laptop or on an iPad. We have rooms designated for telemedicine services. We have community partner offices where nonprofit organizations can be and here in our building free of charge and interact with our patient population. And the whole building was really meticulously designed for collaboration. And we have a lot of art in the building, and we also create art. And we have a kiln room for art programming with 2 kilns, 1 for glass, 1 for pottery. And then the small intangibles, which are also important, the outdoor plaza, the amazing kinetic sculptures by Anthony Howe, a fenced vegetable garden, and many, many other unique features. So the other facility that we built during the pandemic is the Autism Care for Toddler Clinic in Omaha North. We got an angel donation that enabled this, and we opened our doors about 6 months ago in the Ames Shopping Center. And the director of this facility is Liz Prius. And basically, we followed the same model that we implemented initially when I came at the ACT Clinic on the 90th and Q Street. And this is about an 8,000 square feet facility, and that provides diagnostics and treatment clinic for autism, ages 2 and 5, and the early intervention services are provided using applied behavioral analysis. At full capacity, non-pandemic time, it will be 80 to 20 children with about 25 providers. The challenge is always, as operating with any facility, is the staffing and reimbursement. So we have a number of new programs, as I already alluded to. The first is the outpatient center, and under the management of Carrie Tolley. We have a care coordination with Jennifer Ritchie, the vision and optical retail shop with Karen Wilson and Lori Cervantes, the dentistry and dental hygiene with Claire Kokol, the audiology we are exploring in progress with, we are exploring the services in collaboration with Boys Town. The Healthy Living is by Amy Volkman. The aquatic programs expanded with under the supervision of Nicole Giron. The virtual reality and augmented reality research program is run by Jamie Geringer, and it's a phenomenal cutting-edge, world-class program. The action, as I mentioned already, is with Elizabeth Prius, and we have the Emotional Research Laboratory by Jenny Blackford, who assumed the directorship of research at MMI and runs an amazing research program. This was also a period of transition, a leadership transition. And we had a number of retirements and people who built this enterprise and who have been amazing over the years for us. From Wayne Stuberg to Barb Jackson, Gail Seguera, Courtney Burnett, Joanne Johnson, Kathleen Piazza, Wayne Fisher, Jennifer Sandman, Michael Crawford, Brian Anderson. They are all have been amazing assets to our enterprise. On the other hand, we have a new generation of leaders who are doing exceptionally well. And you see the names here. And I think that we are expecting great things from them. And they are already doing exceptionally well. The diversity efforts are also very important to point out. Our first town hall meeting with about 200 participants was held by Zoom on June 9th, 2020. And we formed a diversity and inclusion committee and led by Jackie Hankins and Graciela Sharif. Graciela and Jackie became members of the directors and the clinical directors meeting, so that whatever we do, we have this lens of how does it affect diversity efforts in the Institute. We established a dedicated diversity fund. We formed a diversity library and book club and organized multiple online lectures. We are very hard working on and revising our advertisement and recruitment practices, and everyone who should do who should participate in the recruitment process should undergo D&I training and unbiased hiring training and so on. So we want to make sure that we are paying particular attention to diversifying our workforce. We also held an MMI Summer Institute. A little bit later, I will talk a little bit more about that. The community engagement is always one of our key pillars also. So we had more than 185 community training activities with some 10,000 people almost attending our events. And we secured the capital funds and an additional almost $6 million in philanthropy for programmatic needs. We established a number of internal websites, the formal volunteering program in addition to the 500 or so volunteers that we have in the rec therapy annually. The art collection is pretty amazing in our building, and we are working on a brochure with the highlights. So definitely this is a very, very artsy and welcoming building. And we are showcasing our building, and we conducted more than 150 tours for the various community partners, government, stakeholders, friends, and so on. We have quite a strong social media following, and we are paying also attention to be bilingual. The new website is a much improved one, and we are piloting it for the whole university, UNMC campus. The gift shop and the staff fitness center is also overseen by our community engagement. And we restructured employee recognition and MMI standouts and celebration of excellence to make sure that we acknowledge our employees who are doing amazing things. I'm pleased to tell you that the ABA doctoral program received full accreditation and was renewed in 2020 through 2024. The master's program had a 100 pass rate on the board both years. We graduated our first class of genetic counselors, graduated 2 genetic medicine fellows, and we captured them to our workforce. We placed a graduate of our psychology internship and fellowship programs in an integrated primary care in partnership with Franciscan Health and in West Point, Nebraska. Hired one of our ABA fellows into an ICASD faculty position. And really a big feather in our cap, and that the land grant under the leadership of Cindy Ellis has been renewed. And it is a critical component of everything what we do here at MMI. We held a summer institute of 2 cohorts of a week-long summer experience for high school students. And they rotated through the various departments, and basically we presented them the career opportunities that exist here at MMI, and we hope to attract them into our workforce. The High School Alliance has a semester-long intensive in-depth career exploration for high school students, and this fall we run the first one with 16 students. The research is also strengthened under the leadership and arrival of Jenny Blackford, and we are paying a lot of attention to the mentorship of junior scientists who are doing exceptionally well and submitting new grants and growing as researchers. And Jenny has assisted with all these new grant applications. And we have obtained 2 new grants, NIH grants, to Jenny's lab. So very well done. We are talking quite a bit about research productivity and training, and how does it work with junior faculty members. And we have now a mentoring program that teaches them how to be good researchers for more than 20 young faculty. And we are also exploring collaborations with the various institutes within UNMC, with UNO, and with a number of outside organizations also. We will want to develop an MMI recruitment registry with an idea that we can really develop new knowledge that helps guiding our clinical endeavors and bring the overall worldwide knowledge to the new level about the things that we are doing. And again, we are revising the internal grant processes to improve the quality of the projects and increase the chance that these applications will get funded, ideally first a little funding and then growing and becoming bigger and bigger, and ultimately going for the big NIH grants and center grants. In the community, we are also collaborating with the community. The school system, we have a strong presence in Millard, Westside, Scott, and Madonna, mostly but not exclusively behavioral health. We expanded the medically handicapped children's program contract. So this is also an important endeavor. We had a number of Go Baby Go events. If you remember, these are the cars that in collaboration with engineering, we adapted for youngsters facing mobility challenges. We are exploring collaboration right now and some kind of a education relationship with the Great Plains Hospital in North Platte, mainly in the autism area. And we had a pretty amazing collaboration and coordination with the Nebraska Department of Health and Human Services. Another important collaboration for us was Avenue Scholars. And this is basically part of the endeavor to try to increase the diversity of our workforce. There was also a number of administrative reorganizations. First, the Integrated Center for Autism Spectrum Disorders have been completely reorganized. And we had to reorganize also the Patient Information Office and the business services to have a clear separation who is doing what, and to make it more customer friendly. The Human Genetics Laboratory is now run together with Nebraska Medicine, and Nebraska Medicine is overseeing the daily activities. And this has been a very, very good relationship for both of us. The developmental and behavioral pediatrics became part of the children's specialty physicians, and I think that also worked out very well. And finally, the IT became IT and informatics, because the informatic piece has to be paid much more attention to, especially as we are building research databases. It's not only about fixing a computer, but advancing the knowledge. Well, and then obviously it comes COVID-19. And however, I would love to avoid this slide. I want to say that there is certainly a pride in that how we handled this pandemic. First, we never shut down. We are essential providers. And no employee lost a job due to COVID-19. We managed to pivot over 85% of our telehealth services within 3 weeks when the pandemic hit. And that took a lot of effort from everyone, and the whole institute was amazing to make the transition. The other big point of pride for me is that as far as we know, there has been no transmission between providers, provider to provider, or patient to provider at all. Basically, yes, our people are coming down with COVID, but these are all, we can trace them back to community acquired or family acquired sources. So the masking, the hygiene, the procedures that we implemented work. And this is a safe environment to bring your loved ones to us for treatment. Over 95% vaccination rate for all MMI employees. And another point of pride is that thanks to the MMI and DHHS efforts, we were the first state in the union to offer priority access to COVID-19 vaccines to individuals with intellectual and developmental disabilities, their families, caregivers, coaches, and those who interact with them. And Department of Psychiatry, Psychology organically established a free behavioral telehealth consultation clinic, and we are very grateful to them. Other notable events. For the first time in our history, we as a facility became a licensed DHHS facility, health clinic. And we were successful to obtain some limited PPP loans and federal COVID-19 funds. As you know, the longtime associate director and previous interim director, Wayne Stuberg, who also served as a department of physical therapy, has retired. And in recognition of his long 35-year plus career at MMI, the director of physical therapy department is named the Wayne A. Stuberg Director of Physical Therapy. we had an angel donor come forward and created an endowed professorship for our Director of Community Engagement, Melanie Welsh. The Yale family was extremely generous and gracious and established a chair for the director of the Integrated Center for Autism Spectrum Disorders. We had one tragic loss of the Associate Director of the Department of Psychology, Dr. Rachel Ballally. We survived a pretty nasty cyber attack, and our internal servers, MMI servers, were not affected by it. So I have to give all the kudos to our IT personnel. And we had a very nice healthy athlete screening for Special Olympics Nebraska participants that was about 6 months ago and was extremely successful. Thank you for everyone who participated in it. And the main challenges. So what are our main challenges? The first is obviously safely operating under the COVID-19 environment, right? The second is that the budget. It's always about the budget and to make sure that we have the revenue and that the loss of revenue that is imposed to a certain degree on us by COVID, that we can mitigate it to the best of our knowledge. Also, it is not easy to recruit during a pandemic. People don't want to travel, and really someone who wants to work with us should see our amazing facility, should meet our amazing providers, the incredible directors that we have. So that is always a challenge. And frankly, the wait list for autism spectrum disorders diagnostic and treatment services is far from where it should be. And we are very much aware of it and working on it. But we need to start showing a little bit more movement, or quite a bit of more movement. The political climate is also, we don't live in a vacuum. And just as the whole society is polarized, our providers and patients, for that matter, also have strong views about certain things. And everyone knows that during this pandemic, the fuse was a little bit shorter than usual. So in a sense, we had to be very careful that we nurture the culture of tolerance and inclusion and appreciation of your human fellow being, and give grace and give the benefit of the doubt and treat everyone nicely. And finally, this whole environment, working hard under uncertainties, having family challenges, having COVID challenges, this put a huge stress on our employees. And we are seeing significant signs of burnout. And hopefully, ultimately, this COVID will be over at one point. And from pandemic, we will transition to endemic. And hopefully that we will be able to do a much better job to address this stress and burnout. So where do we go in the future from here? Well, there is only one priority at this point in my mind, and it is growth. We need to grow. We need to expand existing services. We need to start new services. And we asked all the department directors to submit a 5-year and a 1-year growth and staffing plan, and what are the new programs that they want to establish and so on. They submitted it, and this is how they will be reviewed by me and by the leadership, that basically the programs that they created, I really hope that they can deliver what they promised. And we will continue to review, revise, and hopefully expand them in the near future. The big focus has to be on quality and patient experience. we are moving towards central scheduling and templating whenever it's possible, so that it doesn't happen that on Monday, you have at 2 o'clock an appointment for speech language, and on Tuesday, you have to come back for a different appointment in the physical therapy department. That shouldn't happen. The idea here is that we are streamlining all the services. If you need multiple services, that we are able to schedule back to back, and that we coordinate between the different services that we provide. I already talked about the care coordination. So this is a very important part of what we do, I think, and the future, where you really have someone who is there for you, who is trying to schedule you to do the best coordination of all the services and needs, and can be a resource for you whenever you need something. The unfortunate part on that one is obviously that that a lot of that stuff is not reimbursable, and as the country voted that healthcare is a commodity to be traded and not a human right, we unfortunately have to run it as a business. So the need is always endless and the resources are always limited, and that's one of the main challenges that we have. We established multiple ways already for patients and employees that can provide feedbacks and suggestions. This is working actually very well, from paper copies to electronic feedback boxes and so on. And we are carefully reviewing, and we implemented quite a few changes based on the feedback that we received. Again, I already mentioned the PIO to be more customer-oriented, and we implemented new procedures to monitor and ensure compliance at multiple levels. New services will be also very important. We want to grow it, and the new services. And there are two different types of new services that we can envision. Some that we are growing from our own internal strength and expanding it, and what we will fully own. And this could be an inborn metabolic transplant clinic, a swimming club, and the Special Olympics, Nebraska athletic training, the cerebral visual impairment clinic, and so on. So a number of these ones. And then the other thing, the other set of these new services is in partnerships. I would love to have the individual and developmental disability psychiatry clinic in our building, a similar neurology clinic, an orthopedics clinic, a sleep medicine clinic, an epilepsy clinic, exploring also a primary medical home where you would have general pediatricians in our building, podiatry potentially. So it's we are looking for partners, and we will expand as much as we can. So grow. It's grow every service and all our activity. We have to make sure that these recruitment are diversity sensitive. And if there is something interesting that the pandemic taught us, that there is a role for flexibility and telecommuting and thinking about how can we provide our services in a flexible way and still achieve the same results, or in some cases even better results. So there is quite a bit of, I think that we will see for a considerable time quite a bit of these telecommuting and flex time work hours. And obviously, we have to continuously revisit the compensation as needed. We are certainly not the best paying enterprise. And that's always one of the challenges. Philanthropy is important for us, and priorities, and again, these philanthropy seed monies or continuous investments are so important to start up growth. So we do want to establish a number of endowed professorships and chairs to have continuous funding for our pilot research programs that ultimately result in major federal grants. We would like to have an endowment for the ABA PhD program so that we can train the next generation of providers and researchers. An endowment for a care coordination would be also life-changing for us because those are, as I mentioned earlier, not reimbursable services. An endowment for the Caring of Champions program would be very important. And ultimately, now we have 2 ACT clinics, one in North Omaha, one on the south side at 90th and Q. And if we can, we would love to have a number of these ACT clinics further grow across the whole state. And I think that this is a very important point, that if someone lives in rural Nebraska, 4 or 5 hours from Omaha, there is a very small chance or that their children who need ABA services would be able to attend 3, 4, 5 times a week an ACT clinic. So what we should do is try to put these ACT clinics, small ACT clinics, in the places where there is a need, and we can run it as a hub being the main MMI building and a spoke system at the remote locations. And again, the darn wait list. So the current wait list, some of them, especially in the autism area, are unacceptable for the community and unacceptable for us. And any great idea we want to explore, and that goes from the aggressive recruitment of the new providers to the overload payment for existing providers to do additional work, to parent and teacher training, to hiring outside providers for additional work, to pretty much any other ideas that we can come up with. So this is a work in progress. This is probably one of the hardest nuts to crack for us. And frankly, we are not different in that sense than the other centers around the country. So we have to find that magic solution here, because the needs are staggering and we just can't, with the current personnel, we can't meet the demand. Again, I mentioned already that only trained individuals should participate on search committees, and we have to follow the best advertising and hiring practices, and there is plenty of literature out on it, how it should be done, and everyone should be trained in it. And the other thing is that we have to pay attention to the climate and our mindset, and it has to be a sustained effort to ensure that we have an inclusive climate. And the promotion and tenure committee should pay particular attention to their practices in the lights of D&I, diversity, equity, and inclusion goals. And again, I think that it's very clear that the measurement of a success is not by the number of the meetings that we hold, a number of advertisement, a number of there are clear deliverables and a clear goal. And that is really to make this a much more diverse enterprise than we are currently. So the research program should grow and will grow. I'm very confident in that. And this mentoring and training of junior faculty is so essential for our endeavors. And by pre-reviewing outgoing funding applications, we'll ensure that they have a higher rate of success. we have to provide infrastructure and support systems for the individuals who want to be involved in the research. And ultimately, if we do everything right, we will increase the federal grant portfolio and increase the number of peer-reviewed journal publications. And at that point, we will be much better positioned to participate into national networks across the whole country and be partners who can bring things to the table. And that's what we are working on right now. We are part of multiple of these networks. And that certainly contributes to the recognition of MMI across the whole world. New educational programs. We had quite a bit of debate on this first one, that we are thinking about what would it take to establish one of the very few PhD programs in the country that would be a PhD in developmental disabilities. And you might have a concentration area, but you would, and that can be from speech language pathology to pretty much anything that we do here, but it would have this overarching feel that when you finish that PhD, you are an expert in developmental disabilities and you are appreciating all the intricacies and not only your profession, which might be physical therapy or speech language pathology. So the other interesting idea was here, can we make it available to our current employees to do it while they are working? And it might take a longer time for them to finish, but is this really an avenue to further growth and advancement of a career? We want greatly to increase parent education and training programs and teacher education and training programs. And again, we want also to pay a lot of attention to leadership development and career advancement. So we have a number of new department directors, and they certainly have the innate ability to inspire, but we also want to make sure that they have the acquired skill sets for management and interactions and bravery and everything else to take the departments to the next levels. We are establishing a mentoring program for the newly appointed department directors, and it will have two components in it. One will be interface toward the university, and the second is leadership skills, and that will be provided by Solve Talent, and there will be from group coachings to one-on-one coachings provided to them. Also, we shouldn't forget that it's not only the newly minted department directors, but we have many, many junior faculty with incredible growth and leadership potential. And we will continuously look and are looking from iLead and every other opportunity to develop them further to reach their full leadership potential. And again, we have been talking also about what is the way to make sure that staff are also promoted and can progress in their careers, not only faculty members. This is a little bit harder because there is not a clear career laddering in many of the for many of the staff members, but I think that for most of the areas we can do something. And ultimately, that's a big headache, always improve reimbursement. It's always the fiscal strain that is on us. Some of the bad payers, basically it costs us more to deliver services to a child than what we are being reimbursed. And this puts a strain on the system, and this limits our growth opportunities. And with that, thank you for listening. Thank you for caring for us. And I will stop my screen share and take any of your questions. Let me see if I have something here in the chat. I'm not getting any questions. Is there anything that you would like to hear more about, or something that I didn't touch upon? I know it's a very high-level overview. Basically, we could have a presentation for each department that they can tell about the amazing things that they did. But again, and I have to thank again to an amazing institute, because I'm here in front of you talking about them, but that's not me who did the amazing work. It was them. Kim, anything on the other side coming in?
Thank you, Dr. Mirnics. Not at this time. I do not have any questions.
So we had a good number of participants. I see that there are 105 people on it right now. So I don't know what else can I talk about. There are so many things. It was so hard to put together this presentation with all the achievements, and had the search begun for the new director of ICASD? Yes. We have currently 3 candidates who are coming back for formal interview in the beginning of February. The search committee has been assembled. The search committee is made up by representatives of patients, providers, UNMC, Boys Town, Children's Hospital. So it's a very diverse group. Right now we have 3 candidates who will be invited for interview. Amy Nordness, who is the Associate Director of MMI and Director of Clinical Services, is the chair of the search committee. Amy, if you want to give more information at this point about this.
I think you covered it pretty well, Dr. Mirnics. We have all 3 candidates scheduled for February. We're doing a little bit of a different structure to the interviews. So we are going to have a scenario that we have all of our candidates respond to, kind of about our future growth. So we're looking forward to that.
Thank you, Amy.
Dr. Mirnics, I do have one question in the chat. You talked about expansion of the ACT clinics. Would the expansion just be in rural areas or other cities across the state?
So thank you for that question. I didn't clarify that. So what do you need for to establish a new ACT clinic? What did we learn? First, you need an angel donor who will come through and help us establish, because it takes about roughly $1.5 million to $2 million to establish a new ACT clinic of the same size. The second, I'm not worried about the need of the families, because there is virtually every community, but the other is that we need personnel, well-trained personnel who can run it, right? And we need a physical facility that we can renovate or build or something like that. So in a way, it depends very much on where can we find these 3. If it will be, I don't have a predetermined basically location in mind. It can be in Norfolk, it can be in Lincoln, it can be in Kearney, it can be in Grand Island, I don't know. It's where we can make inroads. And again, it's sort of the general philosophy on a lot of times that if something takes a tremendous amount of effort and have very little movement, versus you have something that is, you just start the idea and it blossoms out of it, which one will you follow? So in a sense, it's we are looking out for the opportunity. And if the opportunity comes along, we want to seize it. So I don't know which will be the next one. But I would certainly like to see, it was always my vision that we would like to see this across the whole state in the next 10 to 15 years.
The next question, what are the possible options for expanding care coordination that you are investigating?
The potential option is hire more care coordinators and so basically expand it and find funding for it. That's really the key of it. The need is always endless. The resources are always limited. Our growth is limited by resources on the care coordination. So what we would like to see is really a care coordination that we are organizing right now, and Amy is working on it very much, that there are different levels of coordination that you need. Sometimes you need medical coordination that maybe a nurse is in the best position. Sometimes you need a complex coordination with other agencies and so on, where the social worker is needed. And sometimes the parent resource coordinators that we hire are doing a fantastic job and can answer some of the other less complex issues and be of assistance. Amy, do you want to add anything to that?
I think that right now we're currently expanding at all those levels. And so it's really trying to define when you assign the social worker, when you assign the parent resource coordinator, making sure that we're making the best use of all of those and getting the right person with the right family and kind of matching up those needs. We're also looking at some different ways to possibly fund that. So if we can grow that entity, then we want to grow the volume. And so it all plays in hand together.
So I see here, please speak more about how are you attempting to create partnership clinics. So we have two different models on that one. One is, for example, the Vision clinic, where we are basically buying an FTE from the providers. And the other model is where we just make available, and that would be the dentistry model that we have in the building, is that we are making available our space free of charge, but they are billing and they are running their own services. How are we attempting to create? We are talking to all these chairs who have these services, and we are talking about what does it take and what is their capacity and how would it function and who would schedule. And we have the discussions from the ongoing for child neurology, child psychiatry. Then we have with orthopedic surgery, then audiology, and with Boys Town, and I think a couple of more, but certainly it's starting up a service is, as we learned, is not as simple. You have to know what are your resources, you know, make sure that the scheduling is right, make sure that the patients know about you and the new services that you are starting up. So it takes a while till you thoughtfully establish a service.
The next question is, can you explain what an angel donor is and how do we find more of those donors? They sound amazing. What can we do to contribute to that process?
The angel donor is someone who, probably I used the wrong word. Every person who donates is an angel donor. However, some donors have the capacity to give a significant amount that would enable establishing something completely new and that we can count on. Now, how do we do this? We have a very strong relationship with the NU Foundation. We work very closely with them. And we have a director of development for MMI and at the NU Foundation. And Jessica is doing an incredible job to find and identify these major donors who buy into our vision and enable us to establish an amazing new service at an amazing new location or in our building. And it's the part of it is understanding the passion of the philanthropist. And if our vision and their passion gel together, then we can achieve amazing things together. How do we find them? You know, that's the you never know, you know. Certainly we have been successful in finding angel donors for, including the ACT clinic in Omaha North. Can I describe the VR AR program? So the virtual reality and augmented reality program is run by a previous Scott scholar, computer engineer with a PhD, Jamie Geringer. And the idea is here that you create virtual reality and augmented reality programs that are run on the home computer and address the needs of the population that we serve. So in a sense, we have a haircut program, we have an airplane program. So for example, if you think about it, that 50% of children with autism find very challenging the sensory environment of an airplane. So Jamie built a virtual airplane. You put on a headset and you are in a virtual airplane where we control the sounds, the sights, and we can monitor basically, are we desensitizing the child or just stressing out the child even more? So similar rehab tasks are also made, for example, the Habit Camp, which is really for physical rehabilitation and habilitation, is a boring task, and we created out of that task in a virtual environment as an alien shooting game. The scooping task that needs to be done by the hand, it's a party and you are serving ice cream, and so on. So we have some 15 or so programs at the current time. And the important thing on these programs is that they are all created to run on a home computer. And not some fancy mainframe somewhere, but the classical home computer should be the one that this all runs on. And I believe that we are piloting this with the West Side School at the current time. So we will see how that goes. And Jenny is working with Jamie very closely to couple to this actually a research project at top of it, to show actually that it improves clinical outcomes and engagement of kids who are doing it. Yes, Kim, you had something else?
Not a question, just a comment in the Q&A box. Greatly appreciate how transparent and responsive our institute is. So appreciative of the possibility of COVID SARS testing at MMI. Just shows how the leadership prioritizes the safety of our staff and patients.
So thank you for that comment. So for those who don't know, what is this referring to? So the university, UNMC and Nebraska Medicine has done an amazing job in testing. And there is a COVID saliva testing site in Williams Hall. And there were two problems with it. First, that it's pretty far from our new facility. And the second, that the hours were not very good for us because the opening was by the time then our providers start working. So we reached out to Nebraska Medicine and UNMC and Jane Meza, and they were pretty amazing. And they told, fine, if you can find the personnel and find a way to transport back the saliva samples, and we can train your personnel, then you can establish your own testing site, saliva collection for COVID-19 SARS-2 testing at MMI. And I'm pleased to tell that from hard work from Amy and everyone else involved, we will start the COVID saliva testing on Wednesday, unless something changed since this morning. But the plan was that today, our providers, Carrie, Tasha, and who was the third one? Tracy. 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 So they will be trained and have the printer, labels, and everything else needed. And then Wednesday morning, hopefully, we can start saliva collection and survey. And again, this is, I think, an important point, that this was not the leadership's idea. This was the idea from Amanda Zangrillo, Director of Severe Behavior, who sent me an email and asked, hey, what can we do about this? And our job as a leadership is, to a large degree, to listen and to make things happen. When there is a good idea, to find a way to make this happen. And it's great amazing that we have partners in Nebraska Medicine and UNMC who were willing to listen.
Our last question, Dr. Mirnics. This will be asymptomatic testing. Please clarify.
Yes. So the university guidelines. So we implement all the university guidelines always. So what we are allowed to do is basically survey of asymptomatic people. If you have symptoms, you cannot be tested here. That's through occupational health and a completely different procedure prescribed by the university. Patients also cannot be tested through this mechanism. So this is basically, if you feel perfectly fine, don't show any symptoms, but you would love to know whether you are COVID positive or not, then basically you can get tested. But again, for symptomatic, and again, we are following Nebraska Medicine and UNMC guidelines, this cannot be for patients, and this cannot be for symptomatic individuals. That is handled a completely different way according to the rules. Anything else, Kim?
There is one more. If you want to grow, have you considered more of a virtual model for therapy services?
We do a lot of virtual therapy when it is feasible already. So a physical therapist can have some virtual, but probably not fully virtual, right? A diagnostic can be done to a certain degree virtually, but not everything can be done virtually. So we have the part of so Omar, even 3 years ago, well before the pandemics, the genetic medicine put in telehealth cards in various locations, remote locations across the state, so that they can do basically diagnostics through that mechanism. Yes, virtual is definitely a part that is not going away, that we are keeping our virtual portfolio, but this is and even I already told that I'm perfectly fine to explore options that some providers live down in Florida, but work for us. And if they are able to provide the services via telehealth, that's not, if that is feasible, I'm perfectly fine with it. So I think that that's the part that we definitely want to preserve what we established and grow the telehealth service, but without compromising the quality and without compromising, without increasing the chance of a mistake. I think that that's the key thing. So we are certainly, that's the almost an easy way to grow. And it would be easy to put in more telehealth cards across the whole state. The question is that the directors and the providers will have to make that decision based on data, whether it is the right thing to do or it is compromising on the quality of the services.
Karoly, I would also add there that we want to make sure that we are responding to our families and their needs. And if they are asking for teletherapy services, that we want to make sure we're providing that. If they prefer in-person, we want to be in person. So really responding to our families. And then also offering a hybrid approach. So, you know, we've been doing a lot of creative service provision lately when if a family member needs to stay home, that instead of canceling sessions, that we're able to move fluidly between in-person and virtual options.
Yes, and Amy, very good point. Thank you for that. And again, we told basically our providers very clearly from the very beginning that it's the patient choice. It's not the provider's choice. And the first question that our patient information office, when you call for scheduling, should ask you, would you like to be seen in person or via telehealth? Anything else?
At this time, Dr. Mirnics, there are no more questions in the chat.
Thank you very much. Thank you for coming. Thank you for caring. Thank you for being an amazing community. Thank you, Stephanie. And thank you everyone else who participated in this one. See you next year, but in the meanwhile, if you have ever any questions, shoot us an email and we will be glad to provide you further information. Thank you and have a wonderful day. Bye.